Hello and welcome to a new video. Today we'll be talking about hip extension. So hip extension is when we increase the angle between the thigh and the front of the pelvis. It occurs through the sagittal plane and at the hip joint, which is a ball and socket joint. And the hip joint also allows flexion, abduction, adduction, circumduction, and rotation. Before we get into the muscles, it's important to establish some bony landmarks, and it's also important to remember that we're looking at the hip bone posteriorly. So first we have the posterior gluteal line, then we have the posterior inferior surface of the sacrum, then we have the ischial tuberosity, which is also the sitting bones. Then if we move down to the femur, we have the gluteal tuberosity. Then we have the medial condyle of the tibia. And finally, the head of the fibula. There's also one more thing I'd like to go over, and that's a static stabilizer called the sacrotuberous ligament. And that is very important when we come across the gluteus maximus, which is the next muscle. So our first muscle is the gluteus maximus, and the gluteus maximus has a lot of proximal attachments. So the first one being it's proximally attached to the surface of the ilium posterior to the posterior gluteal line. It's also attached to the posterior inferior surface of the sacrum and the coccyx. And of course, it also attaches to the sacrotuberous ligament. And distally, it attaches to the gluteal tuberosity and also the iliotibial band. And its nerve supply is by the inferior gluteal nerve. The next muscle is the biceps femoris. And the biceps femoris has both a short and long head. So the long head has a proximal attachment at the ischial tuberosity, and the short head has a proximal attachment at the linea aspera. And they both are attached to the head of the fibula. And then the long head has a nerve supply from the tibial division of the sciatic nerve, and the short head is by the common fibular division of the sciatic nerve. Next, we have the semimembranosus, and the semimembranosus has a proximal attachment to the ischial tuberosity, and it has a distal attachment to the posterior surface of the medial condyle of the tibia. And the semimembranosus is innervated via the tibial division of the sciatic nerve. The last muscle involved in hip extension is the semitendinosus, and that's just even more posteriorly than the semimembranosus, and it has a proximal attachment at the ischial tuberosity and a distal attachment at the anterior surface of the medial condyle of the tibia. And it's innervated via the tibial division of the sciatic nerve. Thank you for watching all the muscles involved in hip extension.